Healthy California.
A plan to create an efficient and effective single-payer healthcare system.
According to a study by UMass Amherst, it costs $368 billion per year to provide health care to the residents of California and will increase an average of 5.5% annually for the next 10 years. That would bring the annual expense to $628 billion.
And the care isn't even that good. According to the World Health Organization, the U.S. is 37th in healthcare efficiency, is 45th in infant mortality rates, and is 43rd in life expectancy.
So, how do we cut our costs and improve the health of Californians? First, we minimize administration and attain interoperability of care through statewide software automation. Second, we financially incentivize patients to lead healthier lifestyles. And third, we invest in healthcare services such as mental health and addiction treatment so they can become productive, tax-paying consumers.
Improve the health and productivity of California consumers.
The goal of Healthy California will be to not only improve the health of Californians, but to make them more productive. If we take current and future recipients of SSI, unemployment income and benefits, welfare, and other government-subsidized programs and convert them into employable taxpayers, the California economy will reap significant long-term benefits.
The second goal is to lower the cost of healthcare to the economy of the state of California.
The cost of healthcare to California's economy goes beyond the approximated expense of $10,000 per person. Billions of dollars in productivity are lost each year due to preventable chronic disease, addiction, mental illness, and other issues that could either be prevented or treated.
Additionally, $45 billion can be saved per year on administrative costs alone. A single-payer system would allow the use of a single healthcare software platform statewide. A statewide platform automates processes, removes human error, and improves the quality of care by creating interoperability between providers, hospitals, labs, and pharmacies.
The third goal is to attract the best and brightest minds in the medical field to California.
Current Medicare and Medi-Cal payment rates to providers are simply too low. If these rates are nationalized, we will see a significant decrease in medical school enrollments and will eventually see a dearth of qualified medical providers.
The cost savings afforded by administrative efficiencies in Healthy California will allow an increase in provider payment rates to the levels of commercial carriers. By offering fair compensation and a healthcare system devoid of the typical administrative headaches with which providers are currently burdened, California will be able to attract the best and the brightest healthcare providers from around the world.
There are 3 points of emphasis in Healthy California as it relates to patients.
The first is privacy. The privacy of one's medical records is paramount. Unlike money, information that is stolen cannot be restored. All personal health information will be secured with the highest level of encryption. Data will not be maintained on a centralized server. Instead, data will be decentralized with transactions stored on the blockchain, making it far more difficult for hackers to access. Additionally, consumers will be able to choose which providers can see each portion of their medical history.
The second point of emphasis is choice. Consumers will have a primary healthcare advocate in the field of medicine of their choice. Consumers will choose the level of coverage they desire, and they will be able to choose how they pay their share costs, whether it's through monthly premiums or at the time of service.
The third point of emphasis, ease of access. Consumers will have access to a primary health advocate whose job is to treat, counsel, educate, and advocate on their behalf. Medical records will be accessible online. Billing will be straightforward and transparent, with the services explained in layperson terminology, and all administrative processes will be automated to ensure efficiency throughout the system.
There are 3 points of emphasis in Healthy California as it relates to providers.
The first is fair compensation. Medicare and Medi-Cal significantly underpay providers for services. Payment rates need to be increased to ensure the talent pool in the medical profession remains high in order to provide California's consumers with the best medical care possible.
The second point of emphasis is choice. All California providers can freely choose to participate in Healthy California without completing reams of paperwork that is required to participate in the dozens of current health plans.
The third point, ease of use. Providers will no longer need to devote 20% of their income to administration. Scheduling, authorizations, coding, and billing will all be automated. Rather than waiting 30 days or longer to be paid for services, providers will be paid as soon as the service is documented and signed by both the provider and the patient.
Providing health care to 40 million Californians is fraught with pitfalls.
How do we prevent waste, fraud, and abuse?
How does it work?
How do we pay for it?
The primary argument against a single-payer system is that the competition in the private sector will deliver products and services more efficiently and for better value. Government waste and bloated bureaucracies are generally the biggest problem of any public undertaking. Two key components of Healthy California are designed to combat this.
First, all administrative tasks will be computer automated, eliminating the typical bureaucracy that exists in public projects.
Second, a portion of providers' reimbursements will be based on healthy outcomes. Providers will also be financially incentivized to support consumers to return to work. In short, providers will be rewarded if they enable productive consumers.
Billing fraud is another potential problem. However, billing fraud is far more difficult in a completely electronic system. All medical services would require the digital signature of both the patient and the provider, and patients will have greater access to their own medical records, giving them the ability to manage and audit those records.
An electronic system also eliminates the possibility of redundant services. For example, if a specialist orders a lab test that has already been performed, the provider will be notified and given access to the results.
Opioid shopping is eliminated. Opioid addicts will no longer be able to visit multiple doctors with the same condition and receive multiple opioid prescriptions. Pharmacies will be connected on a single platform and will be able to prevent opioid prescription abuse.
One of the most common forms of waste in countries that have socialized medicine is that of physician and consumer-induced demand. Physicians order unnecessary services knowing there is no cost to the patient. Likewise, patients may utilize services unnecessarily because there is no out-of-pocket cost. Patient cost sharing in the form of premiums, deductibles, and copays is an important component of Healthy California and will help prevent the overuse and abuse of services.
One of the biggest problems with the current healthcare system is the lack of price transparency. When patients are treated at a hospital and they do not have insurance, they are subject to the hospital's cash prices. Medical bills are the leading cause of bankruptcy in this country. A standardized statewide fee schedule adjusted for the cost of living eliminates this problem.
COBRA, SSI, and other programs that provide support for the disabled, unemployed, and those that are otherwise unable to work are an important safety net. However, they are prone to abuse. Providers will be rewarded if they are able to convert recipients of these government subsidies into tax-paying consumers. For example, a psychologist treating an unemployed veteran with PTSD would be financially rewarded if they're able to convert the veteran from a tax liability to a taxpayer.
So, how does Healthy California work?
Everyone that is enrolled chooses a primary healthcare advisor or PHA. The PHA is typically not an MD. The PHA could be a nurse practitioner, physician assistant, physical therapist, chiropractor, nutritionist, or therapist.
The PHA is the consumer's first point of contact, their advocate, and their partner in leading a healthy lifestyle. Consumers have many choices in how they access medical records, schedule appointments, and check in for those appointments. Smartphone, thumbprint, ID card, computer, or barcode.
If you don't feel well, you contact your PHA via private message. Your PHA will call or video conference you and will attempt to counsel you to better health. If they are unable to do so, then they will either schedule you for an in-person evaluation or refer you to a more appropriate provider.
All transactions for medical services will be stored on the blockchain. The blockchain is a decentralized transaction ledger that cannot be hacked or altered.
After the medical service is complete, the provider documents the service in the HCA EMR software. The patient digitally acknowledges the encounter on their smartphone.
These entries are represented online as a block.
The block is broadcasted to every party in the network.
Network administrators approve the transaction as valid.
The block is then added to the chain, which provides an indelible and transparent record of the transaction.
And finally, the provider receives an electronic funds transfer into their bank account.
So how does Healthy California lower the cost of healthcare?
The first way Healthy California will lower the cost of healthcare is by reducing preventable chronic disease. It will do so by financially incentivizing consumers to lead healthier lifestyles as it costs less to provide healthcare to a healthier population.
In 2016, heart disease and diabetes alone cost $369 billion in direct healthcare costs and another $192 billion in lost productivity. Per the CDC, 80% of these cases would be eliminated through a reduction in smoking and obesity.
The second way Healthy California will reduce costs is by incentivizing providers to deliver healthy outcomes. Value-based care reduces the number of consumers receiving government assistance and increases the number of taxpayers.
The Council of Economic Advisors estimates that in 2015, the economic cost of opioid crisis was $504 billion. Serious mental illness costs America $193.2 billion in lost earnings per year. California has one of the highest recidivism rates in the country. And according to a 2012 report by the California Department of Corrections and Rehabilitation, just over 65% of those released from California's prison systems return within 3 years. Converting even a small percentage to taxpayers would save billions of dollars.
The third way is implement technology to automate administrative tasks and improve the efficiency of the entire system.
Administrative costs account for 25% of all healthcare costs.
The fourth way Healthy California will reduce costs is by using its statewide buying power to negotiate better pricing with the pharmaceutical companies.
Other countries pay almost half as much for the same medications.
As mentioned earlier, one of the goals of Healthy California is to lower the long-term cost of preventable chronic disease by encouraging consumers to embrace healthier lifestyles.
Consumers would be financially rewarded for mitigating conditions that are within their control.
Each year, each member of Healthy California has the option to take a health score exam to determine whether a patient is mitigating the risk that is within their control. That is, the HSE will indicate how well the patient is preventing potential health conditions. The HSE consists of
Blood pressure,
resting heart rate,
body fat count,
urinalysis,
cholesterol and triglyceride screening,
comprehensive metabolic panel to test liver and kidney function,
flexibility testing,
and measurement of cardiovascular health.
The HSE scores the consumer's health, and the results determine if the consumer earned a rebate or other financial reward.
Another means by which costs will be lowered is by changing how providers are compensated. Provider compensation will have 3 components.
The first is fee-for-service. Most providers are currently reimbursed by this means. The provider performs a service and gets paid for doing so, but it does not incentivize healthy outcomes.
To incentivize healthy outcomes, Healthy California will also reimburse providers for value-based outcomes. When certain metrics are achieved, such as cholesterol levels or blood pressure, then the provider is financially rewarded.
Another way providers will be incentivized is when they're able to effect positive change in patients' economic productivity. If a previously unemployed patient is treated and subsequently starts working, then the provider would again be financially rewarded.
Creating an efficient, healthy California where all administration is automated is fundamental to its success.
Current administrative tasks that would be eliminated include
Scheduling,
authorizations,
coding,
insurance billing,
claim processing and adjudication,
patient billing,
data entry,
referrals,
appeal submission,
appeals processing,
mailing of documentation,
credentialing,
scanning of documentation,
and record transfers.
It currently costs $368 billion to provide healthcare to the 40 million residents of California. However, elimination of administrative expenses will lower the cost within the first year. Other features of the Healthy California will lower costs year over year until preventable chronic illness is reduced to an acceptable cost. There are one-time costs. The development of the software platform. The platform will be shared by providers, patients, pharmacies, and healthcare facilities. It will allow the free exchange of information between the entities to facilitate healthy outcomes and minimize administrative expenses. Providers will need to be trained on the software.
Consumers currently employed in healthcare administration will need to be retrained.
Cost savings achieved through prevention, value-based care, automation of administrative processes, reduction of drug company and hospital price gouging, and other strategies proposed here will allow better care at a lower price. Employer contributions will be replaced by a payroll tax. Other new taxes will not be necessary.
A single-payer system will allow for administrative efficiencies that would otherwise not be possible. 25% of our current healthcare costs are administrative.
Financially incentivizing consumers to live healthier will result in both direct cost savings for healthcare and save billions in lost productivity.
Properly compensating providers ensures that California will maintain the most qualified providers.
System-wide electronic record-keeping will prevent fraud and abuse.
Embracing new technologies, such as the blockchain, will ensure both efficiency and privacy.
Rewarding providers for outcomes will create a larger tax base, ensuring that the burden of the cost of healthcare is shared by more people. Thank you for watching.